Hello, Arvind. This is so I will try to create a referral manually in the dashboard. So this patient is supposed to be added in can time for start of care for tomorrow. So I have it seems like it did not it wasn't received in the dashboard previously, although its referral date is October 10. So what I did is that I created a referral through create referral button here in the referrals tab. So now it's here and I have uploaded the document already. So I see that the extracted summary is already available, and I'm not sure what this is. Um, so I need to clarify that. And uh, I'm not sure also if we can edit this since um, when I created this, I have added a note where it was, where this referral came from. So it's actually a referral from from Tango through the Dina portal. But originally it is a clinic referral. So what happened is that the clinic sent a referral to Tango, and then Tango sent the referral to us. Tango is a third party payer for Humana Medicare insurance. So this is considered as a referral with admission source. The admission source is HMO. Um, so for the extracted summary, I would need to clarify what is this, or if we can edit this. I don't think this is correct. And the referral source name should be, is this supposed to be the case manager's name or the contact person for, from the referral source? Mm, let's see. Golden. And also I added the address as Denver, but on the extracted summary it became Golden. So it's a different address. It's totally a different address. It's supposed to be the 665 um South Clinton Street. But here it's a different address that appeared. Oh, see, I think we need to change this to Tango. Um, Insurance, Humana Medicare. Um, Maybe we can just delete this since it's not necessary yet. For the referral, we can add the verified information after the eligibility check. Okay. So PTOT, I mean the discipline was I did not see the discipline extracted or the discipline information extracted from here. Um and also the order date and the code status or the diagnosis. Let me check if it can be available from other places when I already accept this referral and add it to the Kanban board. So mm, not sure if uh, we don't usually add MRN, so we can just remove this probably. And I'm not sure if we don't really need to put the age as well, but I will put that here just to make sure I'm completing the processes in the dashboard and to make sure that it will be to EMR. Also, I'm not sure if that will, if I will not put the information here. So I'm not sure if it will be um, pushed to EMR later after I completed the process. But let's see. And for the effectivity date, we usually put the beginning and the end date, but there are um, insurance verification where end date is not available. So we just use like beginning date, say for example, March 1, 2025 up to present. But here I'm gonna use the beginning date just to proceed with the process here in the dashboard. But usually um, we should put the beginning and the end date for the effectivity. One. Mhm. Okay. Okay. PCP verification. So since this is originally a clinic referral, so we don't usually do PCP verification if the referral is coming from a clinic or a physician, because that means the PCP is already verified, or the doctor is already verified. I don't know why the information that I've entered are um, they're being removed. I won't complete the form immediately. Or is this supposed to be automatically added from um, from the referral document, or we need to manually input them here? So it's missing 1707. Mm. So I want to be able to finish if this keeps on um repeating. I need to repeat it again. Yes. Yes. Eligibility. Eligibility. I don't know what's happening. It's not letting me input any information. New 6 9 5 9 8 4 0 4 0. And if this will be happening, um, yes, it it will cause delays. So yeah, let me just try and finish this. Physics. Yes. No. Hi, this is Monique. Last name initial is Susan Shirley. Hello, can you hear me? Yes. I'm calling from Eye Care Global Agency. Callback number is 303 993 6393. Tax ID is 843 901 918. Yes, I'm trying to verify if a patient of ours will need authorization for home health services. Yes. The CPT code is the letter G 0299. I think we're in the NPI is 109 335 3997. I don't think there is an email address here.
Address of the facility is
It's
2851
removing the
South
information. My
Parker Road,
God.
Suite 428, Aurora,
Why is it
Colorado
like this?
80001.
So, I won't be able to finish this if this keeps on. It's not letting me. I need to save something. And for this one, staff name. The staff name that we should put here is the name of the contact person from the primary care office. So the staff name on the drop down, it's our clinicians. So we can add this manually based on the PCP verification call. But the main problem here is that I cannot add new information and I don't know why. This is frustrating. It's not letting me add new information. What's happening? I can't proceed. Why? So I should stay in this page. So what if I don't have the information yet? I need to go back again and then it will remove everything that I added. And then this is 25. See, enter it once again. There. So it should not be a clinician, it's the staff from the primary care office. So we can just remove that if that is not available and should not be a required field. So for the chart creation, I'm not sure if the moment that we receive the referral, will it be available in can time immediately? Let me check. So it's not yet in can time. So you should probably click no or choose no. Pre-admission call. So Monique did the pre-admission call. See. So this is a lot of information that will be removed if I will not stay on this page. And um it will keep on repeating the process for this one. There should be full code or DNR. Everything is removed again. This is a repeat information on the PCP verification. I don't know what to do now. Everything will be removed.
Lindsay, this is Monique from ICR Home Health. How are you today? It's good. I'm fine. Thank you for asking. Lindsay, we are your home health care provider for skilled nursing. Are you aware that you are referred by your doctor from Swedish?
I will not be able to complete this
We are going to
because
be the one that will
I did
manage
not
your
really
claim.
memorize everything that I need to put in
This
here.
will take around
So I need
5
to
to
go
10
back
minutes.
to the
Lindsay, are you
PDF file and enter them here. And whenever I do that, it will remove all the other information that I've previously entered. So I will not be able to add them to add everything in one um, sitting. So I will just leave the other information that I cannot remember. I will just leave them blank for now. So for appointment setting, yes, no, excuse me. For delayed SOC approval, it's not necessary. Um, only depends. It depends if the SOC approval is needed or not. There's no tasks available here, so maybe we can just add delayed SOC approval if approval has already been, I mean, the status, like if they've already been requested from the primary care doctor, or was the intake able to get the approval already via verbal order, or a delayed SOC approval is completely not needed. Okay. So I'm not sure what happens after this. It says it's completed. I guess I need to go to the patients tab and push this to EMR, or do I need to still complete this patient overview? So all the other information, I'm not sure if they were auto populated. I mean, if they should be auto populated, but there are still other information that I need to complete here. And I'm afraid if information will be removed again, just like what happens in the Kanban board earlier. So they're not auto-populated here from the Kanban board. So I guess we should auto-populate um, the other processes that we did from the Kanban board to this stage before we push to EMR. Save changes. And I'm not sure if that is necessary, but just wanted to complete and add everything that I have for now before I will push to EMR and save as patient. So PCP data, PCP data here. Okay. So I think we need to repeat everything here. Um, these are not really necessary. So for insurance verification, we just need to put the notes. Um, this one, and that will already tell us that the insurance is verified and the patient is eligible. But I will just add them here. But what we just really need is this one, the notes. We can just the verification notes like this.
8, 4, 3, 9, 0, 1, 9, 618. Eligibility. U 699984040. T 1956. Yes. Medical.
This is also not necessary, the group number, but I will add it anyway this time. This will add
Representative.
this will add to our task if we will be putting that here, but in chart creation, this is not necessary. Okay. So I think I have already added everything here. So let me try to push this to EMR
Representative.
as patient.
No.
Yesterday I tried Rebecca Bell, but it did not push through because I'm not sure if I have actually done it correctly. Because there are other information that I did not include because I don't have them yet. So, but I think for Nancy, um, I have,
My name is Monique.
I think I have added most of the information that's needed to be there. So,
303-993-6390.
and I'm not sure how long will it take for the chart to be created.
Name of the facility is Eye Care.
I want to know if they're already completed AMR status here. Not good. Okay.
Yes. Member's name is Gregory Barnes. Date of birth,
So
September
it's still
30,
cute.
1956. Yes, I'm trying to see if this client would need authorization for home health. Yes. Letter G0291. Yes. What was that? 2851 South Parker Road. 2851 South Parker Road, Suite 428, Aurora, Colorado 8001.
Might have been added here. Oh, here it is already. But let me see if it's added as a patient or as a client. So it's not yet added as a client. So if we push it to EMR as a patient, I don't know if I should have like push it to EMR. Just push to EMR like this one or this one. So what I did earlier is I saved it as a patient. So maybe that's the reason why it's not available in the client list. But yeah, I will have to save and accept it. Um, Let me just find it.
Okay. Can you possibly transfer me to them?
Here.
What was your
So
name again?
it was just added on the intake info under the referral and client intake list. So what we have to do is to convert it into a client. That way it will appear here in the client tab under the client list. So we will need to save and accept it.
I'm just
Um,
uh,
so
I can
I don't think most of the information are in
so
here.
I'm just going to ask
So I will
just to make sure so that I would not be
record. I will continue recording this as if I am manually creating the chart. So um, everything that I did here in the dashboard, we can add it. We can add them here through the referral tab. And what we only need to do, so just to compare, hold on. Just to compare, for us to be able to create this intake info um, page, we can just go to the referral tab and then click on add new intake. Select line of business, then just put um, the patient's information. Since this is Humana Medicare, we will also need to put the MBI of the patient. The date of birth, there and then check duplicate. So since I have added the patient through the dashboard in Copper, there it will show the duplicate records here. So if there is no duplicate, then you can just click on admit as new. But since there is a duplicate, I can just click on this one and then proceed to complete the intake info page. So I think the information and the name of the patient that we should be adding here is the verified, I mean the insured name. Like whatever um shows in the insurance eligibility document, that is what we should add here when we create the chart. Because if the billing department would submit a claim for this patient, they should follow the name that's registered in the insurance, not the name that is available from the referral document. So these are the only information that were auto populated from the dashboard. So I will input all other information that is required for us to be able to save and accept this referral and convert it into a client. So MBI is also needed since it will affect or um it will cause delay on the Oasis and the billing if we will not put the MBI here. If the insurance is Medicare Advantage plan, then we should put them here. Example is this one, the Humana Medicare and the Cigna Medicare, or and then also the United Healthcare Medicare. But for Cigna Commercial and Medicaid, we don't need to put the MBI here.
Gregory Barnes, date of birth is September 13, 1956.
Full code, so we need to put the full code.
Procedure code is the G.
We don't need to put inpatient facilities. We don't need to put this. But for gender identity here,
Please,
okay, I think the address is correct.
tomorrow.
247. Phone number was not auto-populated. And also the email address. It's not here. We don't need to input this. For pharmacy, we need to add this. However, during the pre-admission, I don't think they were able to really add the correct or get the correct
Yes, 47.1.
pharmacy. But I'm gonna add here the Central Pharmacy since it's the available pharmacy during the pre-admission call. We don't need to add the hospital.
NPI is
If we have information for the marital status, the religion and ethnicity, we can also add that. Usually that can be found in the um, referral document.
2851 South Parker Road, in Suite 42, Aurora, Colorado 80014.
So we need to put the place of service, we need to put the living situation, since patient lives with Andrew, patient's son, and we don't need to put this one here. Treatment address is if patient lives in a center or
Okay, wait.
assisted living facility. But this that does not apply here in this patient. For emergency contact, it's also not auto-populated, but
I have them
if we have the
naturally.
information, we need to put that here. So that's Andrew.
Oh, okay. So it will depend upon the diagnosis book. Oh, okay. So while I'm here, can you check the other CPT codes as well?
We don't really need to put everything. We just need to put the name of the patient and the um, the phone number should be here.
Sure. Um, the first one was that one, the G0299. The next one is G0151. The G0152. Lastly, G0156.
Okay, so it should be here. Patient does not have
Oh,
a
for
POA,
now,
but
I'm just
if
checking if
but for
those
patients that
specific codes
have
will need.
POA, we can add them here. And if there's already a POA paper, we can just tick this and then
Okay,
um, click add.
okay, at least five.
We don't need to. We don't really need to put everything here.
Okay.
For family portal access, we use
Yes.
the patient's email address. This is for them to have an access to their documents and schedules
The
in can time.
the Z as in zebra 47.1. Tomorrow, October 17th.
So we don't need to put everything that's not really required. What we usually do is create a temporary password for our patients that they can change during their first login. And we have a specific client approved role here that we will just select. And this will be the access of the clients when they log into their CanTime account.
Yes.
Then just choose same as set for role. There. Sorry. There.
Perfect.
Just click on save.
Can I have a reference?
Then on the other side, this is the referral information. So intake date is when the chart is created. Physician referral date is when the referral has been referred to us. So
All right. Thank you, Camille. That's all I need today. Okay. Okay.
okay, so this was referred on October 10. So this should be changed to October 10. And the requested start of care date is October 17. And um, I did not use my login in Copper here, so this should be my name or Monique's name since this is her patient. This is assigned to her. Referral source, since it's coming from Tango, it should be facility and the referral facility should be Tango. Then proceed to um, admission source. This is transfer from HMO or HMO referral since it's coming from a third party payer. Attending physician is Jonathan Zonka. There. Primary care physician is Jonathan Zonka as well. And 26. So this is the checklist that I was telling the last meeting that we had. So since email verification is verified during the pre-admission, that was the day. Living situation, it was also verified during the pre-admission today. Employer information verified today. Address verification has been verified today. DNR status has been verified today as well. HH order or DC summary has already been received on the 10th. Insurance verification was verified on the 13th. PCP verification on the 10th. Pharmacy verification today. Client documents. So we need to add every document that we have for this patient. Um, so I will need to save the insurance verification document. I will also need to save the authorization and the pre document here. computer is so slow today. Hold on.